So, oh, it's your left rhomboid. Okay. All right, I got myself on the wrong side. That's right. Can you put your arm by your side? So, where does the rhomboids go? You have to know, right? They're pretty easy. They're between, sorry, my hands are so cold. So if you can find the medial border of his scapula, you know they go like this, right? They go from here to the spine, so you know right away where they are. Sometimes this is a little more difficult to find than the upper trap, the motor point of the rhomboid. So sometimes it's a little higher up and you have to be careful because you can get the trap in, or sometimes it's too low and you get in the lats. So what I do is I tell them why we're doing it, you know, indications, contraindications. I usually would do this with the patient sitting, so we're making eye contact. I do my skin check, make sure jewelry was off in the area, and then we need to set up the machine. So let's take a look at the machine. Let me just come on that side then. All right, so someone actually, go ahead, someone use their fingers and let's put it on combo ultrasound. So one of you, so you get a feel of it. All right, so change that. 8 minutes. All right, so now let's look at the target tissue. So it's his rhomboid. So is that superficial or deep?
Deep.
So what is that going to be?
Oh, I was right. One.
That's all right. And is this a chronic issue?
Mm-hmm.
Yes. So what do, continuous, right? And so what are we going to start with in intensity? Yep, perfect.
Wait,
1.0, right? If it's chronic.
Mm-hmm.
Okay. So I would get everything this set up now, because then the other thing to do is to hit start, and then we're going to start increasing the conductance. So let's see if we can spray this. And let's put the ground down here. My hand's cold. You can feel me touching you here, right? And I don't see any skin irritation. So let's do this. So normally I would get in front of you, but I don't want to block your view, so I'll get on this side. So it's going to feel cold, just so you know, okay? Ready? And I'm going to tuck this in your pants a little bit, because I want to make sure there's at least 3 or 4 inches between here and between what I'm doing. And let's see. Actually stays on them pretty good, but I just want to make sure it's off to the side. Okay? And yeah. So I just find, or you can come towards me more. I just find that if you put the arm by the side, it puts it more on slack. If you do sometimes this, you don't see as good of a contraction, so you can do whatever you want on that side. Okay. I'm sorry, I have to get in front here now. So what we're going to do is, in a moment, we're going to start the treatment. And so we have the ultrasound on what's called a thermal setting, so that means you might feel a slight warmth, which is okay. But if you ever felt pain or burning or anything got too hot, you need to let me know. All right, and then I'm going to tell you about the E-stim in a minute. All right, so, and if you're not sure how to find the rhomboid, put the arm behind the back and do the muscle test, right? And find it, okay, and relax. It's going to be cold, so I'm going to put the gel here. And you know, you make sure you're not on the scapula nor on the spine, because then you're going to be off the rhomboid. And I will turn this as best as I can here. All right, so I'm going to hit the start button. So that means I have to keep it moving now. And now do you see the green light is on for conductance? Conductance is about electricity. So now I'm going to increase the intensity 1 milliamp at a time. So with this one here, when you start to feel a tingling or any sensation, you let me know. So you're going to help me find the motor point on this muscle. All right? If anything gets too uncomfortable, you're going to let me know. But also, we're looking for that just twitch for the muscle to contract. Do you feel anything as far as?
Nothing yet.
Okay. This usually takes more juice because it's a deeper muscle. Anything at all yet?
No.
Sometimes students will tell me they feel a little bit lower. Oh, we just get something or no?
I think I saw it, yeah.
Look
Yeah.
like those little twists there.
Yeah, oh, there we go.
You feel it?
I don't feel any tingling. I don't feel the
You
muscle
don't
twitch.
see the muscle twitching.
I don't feel it, no.
I saw it too.
Yeah, it's right. It's more like the rhomboid
Oh, there it
minor.
is.
So that's all we need. So I'm gonna hit start. That was way too easy because usually it's way harder than that. Is that okay?
Mhm.
All right. So again, you're gonna let me know if you feel a slight warmth with the ultrasound. We're gonna let it go another minute or so. And if it's not warm enough, then we'll increase it a little bit. Comfortable?
Yeah, it could be a little warmer.
Okay, so what do? We go to CH, we go back to the 1.0. I'm gonna increase it a little bit.
So, I see it now.
And it's actually getting a little stronger. Because I'm gonna come around and get the gel because probably the ultrasound is warming up and remember nerves like warmth. So his contraction was so easy because he has more muscle tissue there. He's probably well hydrated, so it's an easy contraction. It's usually not this easy.
Mine's probably be real bad.
Feels
Huh?
like you're hitting the speed
Mine would
bump.
be real
You're
bad.
jacked up.
All right, so that's how you do the treatment.
Hydrated.
So, paper towels,
I'm not ready.
Rip.
just hang out there, don't move yet. The biggest mistake that students make is they forget to, I'll take care of him first and then we'll, yeah, I'll need more, then we'll clean that off. So the biggest mistake they make is they forget to use the ground. So a lot of times the machine will shut itself off. Thank you, during the treatment, and if it does that, probably you're forgetting something, so you just start it again. If you haven't done anything with safety, it's not necessarily a fail. Can you feel me touching you here?
Yes.
And can you feel me touching you here? And I don't see any redness, I mean, other than it looks like maybe, I don't know what that is, almost like a scratch mark. You can see a little bit
I don't know what that is.
of wetness here, I don't know.
He's mad.
Yeah, I mean, he's you know, has sensitive skin, but just make sure you do skin checks both areas, positioning, draping. So what I'd like you to do is break up, we have four machines, we haven't